So for the sperm testing, I usually have them ask their MD for the test. They're set up to do it. However, what's really cool is there is now at-home sperm testing, and it's very cool. So this male fertility kit, you place some sperm on a slide. It goes under a viewing unit, and it will actually share the screen with your TV. So you can see the sperm in real time for yourself and, really get a great idea about how healthy the sperm is. Less than $100 and really a lot easier than going into the lab. Hi, and welcome to The Balancing Point. I'm Dr. John NIETERS, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hi there, this is Dr. John again. I want to thank you for joining us for another episode of The Balancing Point. And today is one of my favorite topics. Again, my doctoral work is in gynecological endocrinology. So I've done a lot of fertility work and a lot of gynecology work, which I really enjoy. And so today I'm going to talk about Western testing. Now, in Chinese medicine, we have all kinds of things that we look at around fertility and have different ways to kind of figure things out. But today I'm going to talk about the functional medicine aspect of this. So we're going to take a quick run through some tests that you want to consider or should be considered if you're looking at fertility. And these don't have to be run by a fertility physician. Most of these are fairly inexpensive, some of them really inexpensive. And you can kind of take charge of your fertility whenever you're ready. Okay, so let's go ahead and take a run through these. First, we're going to talk about male testing and then female. And we'll talk about male first because it's a lot simpler. Okay. So male testing, we look for hormones. We're looking for sex hormones. So that's testosterone, free testosterone, estrogen. That's a surprise for a lot of people, but it's really an important thing. And then I have sex hormone binding globulin with an extra X in sex. So there you go. And so these are all very important. I'm going to show a lab result looking at testosterone and free testosterone. Now, a lot of doctors will only look at total testosterone, and that's a real mistake because it's free testosterone that really gives you the bang for your buck. And I've seen people with perfect testosterone levels have really low free testosterone levels, so they had, all the symptoms of low T. Estrogen, because if you're not producing enough free testosterone, sometimes you're converting the testosterone to estrogen, which can then be a problem. And you see this in men that do testosterone supplementation or steroid supplementation will often get what we colloquially call man boobs, right? From all the estrogen activating their breast tissue. Sex hormone binding globulin is really, really important. Very important, and it's not run nearly often enough. So you could have perfect testosterone. For a female, you could have perfect progesterone, perfect estrogen. But if your sex hormone binding globulin is too high, and that's a hormone that is just what it says, it binds your sex hormones, so you can't utilize them. And I've had many women come in, progesterone was fine, testosterone was fine, everything was fine. And then we'd run sex hormone binding globulin, and it was too high, so they weren't utilizing those hormones. And sex hormone binding globulin is one of those hormones that goes up with stress. So this is typical, I'd guess that 90% of my patients, female patients that come to me with unexplained infertility, 90% of the time, that is explainable by stress. And if they take some time off, if they go on vacation, often they get pregnant because their sex hormone binding globulin goes down. Then we test for inflammation and immunity, C-reactive protein, CRP, which is a systemic quantitative measure of inflammation. C-reactive protein is something that is produced if there's inflammation. But then we go a step further and we do HS-CRP, which is high sensitivity, sometimes called cardiac CRP, to see if there's inflammation in the heart and or the arteries. Because if there is, it's very hard to get pregnant. You really wanna know the blood flow is getting where you want it to go without inflammation. Homocysteine, it'll give you a lot of information about B vitamin levels. It's very inflammatory, so we wanna check that. Then we do just a simple metabolic panel. We wanna see how, the kidneys, liver, gallbladder, everything are working. A CBC, which is a complete blood count, which unfortunately, when most medical doctors read that, they're taking out about 10% of the available information. They're just looking at levels. Is it too high? Is it too low? For one thing, their levels are not accurate if you're trying to get pregnant. They're far too wide. You can have a 6 times greater chance of dying than if you're at the sweet spot and still be in a so-called normal level. So we really want to really fine tune it. And then thyroid hormones. Thyroid hormones, if you're hypothyroid, very, very difficult to get pregnant unless you're taking something for the hypothyroidism. Want to check your neurotransmitters. We'll check metabolites of your serotonin, of your dopamine, of your melatonin. And then we're going to look at stress hormones, cortisol, epinephrine, norepinephrine. Now, cortisol gets a lot of airtime these days, and cortisol is the hormone that activates your blood sugar, affects blood sugar levels quite a bit. Epinephrine, makes your heart beat fast, and norepinephrine is often overlooked. It is actually, its job is to pull the blood out of your center and get it to your extremities and your brain so you can run away from the tiger. Well, as you can probably imagine, that's a real problem if you're trying to get pregnant because it's going to pull the blood away from the ovaries and the uterus, where you need a very high blood supply in order to nurture everything. And then reverse T3. T3 is a thyroid hormone. And if you're under stress, you'll produce reverse T3, which tricks the body by blocking the T3 receptors so that you get very little bioactivity. So that's the kind of the basic hormones. And again, these are not particularly expensive. Sperm testing, this I just wanted to show you. This is someone that had been on testosterone. You can see up here, the total testosterone was 1595. That's very high. And now it's a more normal 750.9, but the Energizer Bunny is this 10. Now that's kind of a medium range. I'd rather have it a little higher, but you can see 750, but only 10 units of that is really bioavailable to use. Hemoglobin A1C to measure blood sugars over a 3 to 4 month time. And then sperm testing. So they're gonna test for motility. Can it swim? And they actually have put them. They used to, I'm not sure if they still do this, but they put it on a little grid system and see how long it takes the sperm to swim from point A to point B, because it's a long, long trip up those fallopian tubes. My son once was watching a Nova video, and he said, "Daddy, watch this." And it was the first time they'd ever actually photographed a sperm inside a fallopian tube, and it looked like a little tiny fishy trying to swim up the Amazon. It's a lot of hard work. And so we wanna know that sperm are healthy enough to get to where they need to go. Morphology, to show if we have viable, healthy sperm, if the shape's okay. And then we're gonna look at the sperm level per unit of volume, and then the semen volume, because there needs to be enough semen also to carry out the load, and then liquefaction. And so here's a picture of here's a normal oval form here, just looking beautiful, beautiful head, the neck, and the tail. So the genetic material's carried in the head. The neck is where the nutrients are, and that's one of the reasons men are easier to treat, because there are a couple of basic supplements that can really energize the sperm and really get that neck full of the proper nutrients. And then we can see the other morphological problems. You don't want a two-headed sperm. You don't want a two-tailed sperm. So they look at the motility. Now, here's the problem. Getting to the lab can be quite inconvenient. At one time, the major lab testing uh, company in this area had only one place that was doing sperm testing, and you only had a 20-minute window from the time you ejaculated until you got the sperm delivered. Well, what if you live 30 minutes away? I'll let you figure out how inconvenient that would be. So, for the sperm testing, I usually have them ask their MD for the test. They're set up to do it. However, what's really cool is there is now at home sperm testing, and it's very cool. So, this male fertility kit, you place some sperm on a slide, it goes under a viewing unit, and it will actually share the screen with your TV. So, you can see the sperm in real time for yourself and really get a great idea about how healthy the sperm is. It's less than $100 and really a lot easier than going into the lab. Then female hormones. And so blood testing, just as it sounds, you're going to get a blood draw, saliva testing. The two most common places that people go for that are doctors' data and ZRT labs. I do almost no saliva test anymore, because there are much simpler methods that don't require you to sit around all day and spit in a tube, which doesn't sound that hard, but trust me, my patients have gotten very, very frustrated by that. Now, my favorite test for female hormones is dried urine testing. Couldn't be easier. Several times a day, you pee in a cup, you put a piece of cloth in it that they provide, and then you let it dry. So it's dried urine testing, very, very accurate. And so Dutch testing is the company I most use, but Endolycyte at US Biotech also does a good test. And then at home testing, and we've moved into a whole new world here over the last decade or so. We've got Mira and Inito. There are others. Those are the ones that we have used. And so here's a ZRT report. Here's the first page of a Dutch test. Now, Dutch has changed the appearance a little bit, and I like the new appearance better. But as you can see, if we look up here, we see the estradiol is at the end of the green stage. It's really maxed out, and there's no progesterone. So this is someone that is completely estrogen dominant. Their testosterone's fine. It's mid-range. So we've got estrogen dominance, and down here, this is a circadian cortisol. So they did it 4 times this day, and the cortisol level is bottomed out. This person is totally and completely burned out. So one of the things we're going to have to do with them is get them to relax. And we have lots of methods to do that, but we've really, really got to get that up, because when cortisol is at such a high demand, it will lower DHEA levels, dehydroepiandrosterone levels, which are the precursor for the sex hormones. So we really need to work with the cortisol and the stress, even though we're really looking for pregnancy here. This is another page on it. And you can see how, and it's got all the pathways. Here's pregnenolone off the scale low, and it's the major precursor for progesterone. So this person is going to have, they won't be able to maintain a pregnancy, right? Progesterone is named for progestation, for maintaining a pregnancy. This person would need very significant amounts of progesterone supplementation in order to maintain a pregnancy. And then there's tons of other stuff down here that is relevant for likelihood of developing breast cancer, your ability to methylate. This person can't methylate at all. And the ratios here between the 2 and 16 hydroxyprogesterone are not so good. And here's just another way to look at this. Again, you can see that the cortisol is low. The melatonin is very, very low. Progesterone helps you sleep. Melatonin helps you sleep. This person doesn't sleep. It's one of the reasons they're so burned out. Now, getting to the fun stuff, here's a Mira. We've used Mira quite a bit with our patients. Again, you take first morning urine. You have a little dipstick or wand that you put in the urine, and then you put the urine in this little round device right here, little round device. And in about 20 minutes, it will show your hormone profile. See, it's tracking your estrogen, your progesterone, your follicle stimulating hormone, and your luteinizing hormone. So you can see exactly what day you're the most fertile and if you're even ovulating. So it's just an amazing technology. Down here is the Anito fertility tracker, which we are now switching to. We find it's a little easier to use for us and easier for patients to track it. So we're using the Anito primarily. Same idea. Here, the Anito tracks all 4 of the primary fertility hormones. It says the 4, there are actually more, but these are the biggies. And you can see here, right? You'd go along here, the purple's luteinizing hormone. You get a big surge of luteinizing hormone, and then you're going to get a big surge of progesterone. And then you can see here's peak fertility, and here's a confirmation that there was ovulation. So it's kind of foolproof. Now, if you want more information about fertility hormones or fertility or traditional Chinese medicine, actually about any subject, I do free 15-minute discovery calls. I find I just started doing this in the last year, but I found that people often didn't know where to start. Do I start with my chiropractor? Do I start with my medical doctor? Do I start with an acupuncturist, an herbalist? So I do free 15-minute discovery calls several times during the week to help people, kind of guide them in a certain direction. And so all you have to do is go to alamedaacupuncture.com, and there'll be a box there for you to schedule your free discovery call. Available California residents only. But feel free, just give me a 15-minute call and we'll just talk about stuff. So I want to thank you for joining me today. I love talking about this stuff, and I'll be back with you next week. Thank you. Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.